channels. I feel the same. Okay. Jermaine. Oh. On the chair. We outlined stuff. We was going to do. So we're going to start right now. Yeah.
Good morning, everybody. Peace and blessings, love and light to everybody. Get started. I hope coming in with short buses and some issues that we're going to get started. My name is Giovanni Williams, and I'm the public advocate of New York City. I want to thank Senator and Senator for putting this together and allowing our office to be co-sponsors of Rebirth for Movement, Equity, and Justice for Black moms in New York State. As some of you have heard, after the Senate report is stuck in session. Everybody knows they're trying to work out a budget. I have a lot to say, but I'm not going to say about it right now. But we thank you very much for putting together this important panel. I want to thank Chanel Portia, founder of Ancient Song Dual Services, Tasha J. Wilson, Melanated Moms, Western Region, Kimberly Steele Aller, founder of New York City, Dr. Brandon Robinson, Black Nurses Coalition, Capital Region, and of course the moderator who is not here, Senator Stephanie Zimmerman. But we are going to have an awesome moderator in Jamila Rose, within the public advocate, engagement and public advocate office. Also want to thank Ancient Song Dual Services, Brooklyn Creole Network, Earth App, New York City Black Women's Political Club, Westchester Black Women's Political Caucus, Bronx Health Star Partnerships at Einstein School of Medicine, supporting healthy relationships at Montefiore Medical Center, New York City Religious Union, Buffalo Black Nurses Association, Black Social Workers, Community Voices Heard, National Nurses Association, Melanated Moms and Black Nurses Coalition. Of course, thank everybody for helping us, not just with the panel, but just in general with the work that we're doing on Black maternal health. And I thank all of my staff. We're working on this issue for a few years, and that's the beauty of making sure that we have a diverse staff and make sure that we look at the issues that are pretty germane. And when I started hearing the data, as my staff was telling me how bad it is, when they're going to give birth, it was stunning. And I said we have to do something about his office as much as we can. Lo and behold, I've been sharing my journey of my life. And I thought it would hit so close to home. But I appreciate some folks who do all the prayers that we've been getting. But for those who don't know, I'm new to it. But a week before I was married, I found out my wife had cervical cancer. A week after, they said we wouldn't be able to have any children. And we went and started trying to do surrogacy. Lo and behold, she miraculously pregnant. And they said, we were sure the baby was going to get here healthy. But I walked with the Most High, so that she, 32 weeks later, our beautiful baby girl was born in this world. So in a few weeks, and then she was here as well. But the whole family is up here today, so everybody's been well. Bryce's last chemo radiation is tomorrow. We were trying to shoot for 8 years, just see the difference of when we got someone who actually cared and listened to what she was trying to say, up until that point. realize the juxtaposition. What I heard the most when they say we can have kids, saying little patient, how much people advocating for themselves and want to have kids. And up until that point, all the doctors kept talking about taking her over, without even listening to what it is trying to perform. Actually, we had some few times they said Pastor Neil was good, everything looked good, so we skipped some of the things that we could have done, and lo and behold, it actually was not. So, also interesting, she talked about, I have a beautiful daughter that came along with marriage, who's 13, so that's amazing. But she talked about when she was not married, just starting out young, the type of services she got there would not fall apart from the courses she got when she's married, in her career, doing everything right. Socioeconomic not the determining factor. I'm going to hear that time and time again. So I'm glad that my office was working on these issues. We have a package of legislation in the city council in New York City to try to push forth to make these numbers get better, depending on the city, the state, or the city or the nation. Black women 2 to 3 times to 8 to 9 times more likely to die in childbirth. That's just an unacceptable figure, and the determining factor is the fact that they're black. There's no way around it. We know that, and we're allowing it to happen. But this panel is going to talk about some of the great work we're going to do so it doesn't happen. And I work with many of you who are health sponsors. So I just want to say thank you. This is really important. I appreciate everybody's prayers for my family. It is working, so keep them coming. I appreciate it. Sorry. Please give a round of applause for Jamela Rose.
Thank you, Public Advocate. I'll speak a little loud because we are streaming live, so we have people who will be watching on YouTube and LinkedIn as well as our Facebook channel. And I just want to kick off the morning first by saying thank you to the Public Advocate. Also, thank you to Stephanie Zimmerman for hosting this workshop, co-sponsoring this workshop with us. We know that people are stuck outside and we don't know what the right answers will be, but we have a room of people who are eager to learn more about the maternal child health and what's happening right here on the ground all across the state of New York. Of course, also the Public Advocates in New York City, and we've been organizing there, but we have an esteemed many women parents who have organizing within their respective regions across the state. Let me start by introducing them to you. To my far left, I have Kimberly Seals Hours, and I will read a portion of her bio. Ms. Seals Hours is an award-winning journalist, a 5-time author, and international speaker, strategist, and advocate for maternal and infant health. A former senior editor at Essence and a writer at Fortune magazine, Kimberly is a leading voice on the racial and socio-cultural complexities of birth, breastfeeding, and motherhood. She's also the founder of Earth, a new Yale-like app for Black and Brown parents to address bias and racism in maternity and infant care. And I have Chanel Portia, who I will read a portion of her bio as well. Okay, and Chanel Portia, Albert, CDCPD, CLC, CHHC. That's a lot. That's a tongue twister. Is the founder and chief operating officer of Ancient Song Doula Services, a reproductive health organization focused on providing resources and full spectrum doula services to women of color and marginalized communities throughout New York City and northern New Jersey. Her work within infant and maternal health have led her across the globe to Uganda, where she serves as a maternal health strategist in rural war-torn areas. Her work in birth and reproductive justice continues to span into the research and methods of care of marginalized people and people of color, bringing a human rights framework into birthing rooms and beyond, into institutional reform and accountability measures within healthcare to address implicit bias and racism. Then we also have with us the Honorable Dr. Brenda Robinson. Dr. Brenda Robinson, Doctor of Prepared Vegetables, is a doctorate self-prepared registered nurse who was born and raised in Albany, New York. She also considers herself as a second home. There's many hats revolving around community service, health and advocacy. She has worked for the Veteran Administration for over 25 years in counting. She has been the City of Albany Human Rights Commissioner since 2013. She was re-elected citywide to a second term as Albany Public Library Board Trustee. She is also president of the Arbor Hill National Association. She is CEO and founder of the Black Nurses Coalition Incorporated, which has a mission to eliminate healthcare disparities amongst minorities and low-income individuals. One note, she is the first African-American board member of Capcom Federal Credit Union, and she actively wears all of these hats and is dedicated and promotes partnership. And lastly, but not least, we have Jay. And if I could get my papers together. Yes. And Jay Wilson, through compassionate advocacy, nurturing mentorship, and resilient mothering, Jatisha J. Wilson is reshaping the world of maternal health for women of color. She is a nurse, CEO, founder, social impact speaker, maternal health advocate, self-sufficiency coach, and mother to two brilliant young girls. Derived from her own experiences with adversity, motherhood, and overcoming, Jay's work and resiliency has inspired the lives of women across the globe and is changing how we think of parenting. In her professional career, she works in community health and outreach as a nursing operational manager while simultaneously lobbying Washington, D.C., New York, New Jersey as a community advocate for the LGBT community. In these positions, she has gained more nuanced understanding of the importance of advocacy and how public engagement can create better physical, emotional, and mental health outcomes for community. She is also the co-founder of Melanated Moms. And let me introduce Assemblywoman Stephanie Zimmerman. Let's give her a round of applause.
The budget has passed.
Okay.
Welcome everybody. It is good to see you. It is good to be here with you this morning. Welcome to the 51st annual Black New York State Black Puerto Rican Hispanic Puerto Rican Asian Legislative Conference. That's always deserve a round of applause. Because of the coalition staying so strong during that. We have been in the business of educating and empowering communities of color for decades, and this is certainly one of those topics that deserves all of our attention at this time. So I really want to thank the public advocate for using his office, his platform, his personal experiences to help women across the state of New York and the state of Buffalo with information, resources, and a sense of self-efficacy that we can push back on racism that continues to destroy the lives of Black and brown communities. So I thank you all for being here to support this cause. I cannot wait for you all to hear from these dynamic women on this panel. I mean, you're going to hear the rest of the bios, but they have been doing some similar work in this area. And I just want to close. I mean, I have a story. I don't want to tell my story now because we're in this moment. I do want to say that we've got to continue to rely on each other. We have always been our own saviors. From the midwife that delivered my mother and my uncle and my grandmother's house to the midwife who delivered my daughter. We know what the issue is. We also know we can help lives. And this panel and these women and this man are doing the work to continue to keep our community safe, but also make sure that our babies are born healthy and well, and that their mothers are there to celebrate their birth. So thank you all, and let's continue.
Okay, Thank you. Okay, so we're gonna get started with our first set of questions for the panelists. And so this is our question number one. This question is being posed to all the panelists in front of us. Each of you are trailblazers in the space of Black maternal and infant health and wellness. Can you describe the instance that moved you from advocate to a founder in the Black maternal justice movement? And we'll start with Bishop Melrose. Press it once, it should be on.
Greetings.
Yeah.
All right, wonderful. So the instance that really led me or propelled me to getting into this work is because of my beautiful friend who happens to be sitting in the room here today. Yeah. 13 years ago, I was privileged, and I say it as a privilege, to be able to have a homework with a Black midwife and a Black doula. And after having that experience, it completely changed my life. It changed my outlook. It made me question the ways in which we are taught about healthcare, how we're taught about our bodies, how we are able to center ourselves and really bring in joy and create sacred spaces for our children to come into the world. After that beautiful experience, it made me question, why doesn't every Black woman and birthing person have the opportunity to have an experience like that, where they feel like their autonomy is centered, where they feel like their voice is being heard, where they can have their family members be present with them, right, and be centered in love, and, you know, be able to play music, and, you know, if you need to dance, or you need to sing, or you need to go around, or, you know, you need to hear, have your partner with you and encourage you in a loving and affirming way, have those things, and not feel restricted to the ways in which sometimes institutions can make you feel restricted. And so I took a doula training afterwards with the International Center for Traditional Childbearing, which was created by a lay Southern Black midwife, where I had the opportunity to experience what it felt like to be around Black elders, to be around Black women who said, here, that baby, right? And they took my child and held them, but they also held me at the same time, right? They offered support, they offered wisdom, right? It was a community that I was yearning for and that I was searching for. And so upon taking a doula training that weekend in Harlem at the Adequate and Powell building, which is, Harlem is huge, and I have to mention it because Harlem is the mecca or the catalyst for really, like, for me, starting change, right? For Black institution, for Black thinking, for Black movement building and conversations. And so upon taking that training, I started to attend Births and started to see the ways in which we were disenfranchised, though. How those who were on Medicaid or were considered to be in low income, you know, had to wait 3 or 4 hours for an appointment to be seen just to go into a room and to be dismissed. How individuals were illegally drug tested at bedside and had their children taken away from them from the family regulation system. How I witnessed how the usage of just the use of marijuana during pregnancy, maybe for depression or whatever the case may be, was criminalized. And so it totally changed my framework and said, wait a minute, this is not just about the experience of birthing, it's also about how we're able to center ourselves as Black people within a system that doesn't necessarily see our humanity. Right? And I wanted to be able to create a space where folks could come in and they could be seen and they can be heard and they can know that someone genuinely cared about them. And that is how it actually started and how it continues to manifest itself, being community being at its center, community being at its core, and us really creating safe spaces and really changing institutional policies that are centered in racist frameworks that don't serve us or our communities.
Thank you so much, Chanel, for that. And let's hand it over to Kimberly. If each of you can just give us a quick synopsis of how you got involved in the movement.
Well, thank you so much for having me here. I think motherhood itself was certainly my catalyst as well. When I was pregnant with my daughter, my first child, I did a lot of research. I was trying to find the best place to have a good experience, looking for that hospital, making all the parenting logs. And and, you know, ended up going someplace and walking out feeling incredibly disrespected, traumatized, and seen. And that's a huge burden for me because I felt like I did a lot of research. I thought I had looked and did all that I could prepare myself, and I was mostly unprepared for actually what happened. And in retrospect, what I realized was at that time in my life, I was not yet married, and I was at grad school at Columbia, so I was on student insurance. And despite all of my research and best efforts, I was a black woman with basic insurance, and that's how I was treated, right, regardless of my education or income. And so that experience really shaped me because it became a real personal testimony that people are not being treated the same way, even at the same place. And everything that I read that was mostly kind of Upper East Side mom parenting blogs that were available just did not apply to me. And so that was certainly why I created that as a place for us to share our views publicly, but it certainly activated me to do what I do. My very first book came out back in 2007, talking about the issue, the ways that pregnancy and child is different for us. So it really kind of propelled me into my advocacy role and using the tools that I had, you know, I was used to using in this space.
Okay, thank you so much for that. Dr. Ben Robinson.
Thank you very much for having me. For me, my seed of advocacy began as a young girl, really spent a lot of time with my grandmother, who happened to be a Baptist missionary. And to hang out with her, I had to do what she did. And back in those days, Black folks definitely took care of their own, as she just mentioned, and we visited the sick and the shut-in. So whether you're at home or in the hospital, or on application, or if you were home, you would do activities a day you living for you that you could not do for yourself. So I think my area of being in healthcare and doing what I do, I'm meant to be here, I was groomed to be here, to be a strong advocate, create the Black Nurses Coalition to eliminate healthcare disparities. That mission was embedded in me. I'm a boots on the ground type of person, a community person. Our organization is the same, and we see how minorities and underserved folks are maltreated. Racism in healthcare is certainly alive and well. Myself, I could have easily been a statistic with my second child, giving birth, and second child, let the nurse know, hey, something's wrong. I don't feel well, something's right. She flips it around here and going out the room. Call the light again, and here she comes. And now my husband is there. I'm like, I'm telling you, I don't feel well. Flips her hair and goes out again. Let's get up and goes to the bathroom. Long story short, hemorrhage, left the afterbirth, and then I go back to L&D. These are the type of things that when we say Black women, moms, pregnant women, teen women, older women, regardless of your social economical status, we're not listened to.
That's right.
The equity is not there. The racism is, but the equity isn't. You can't be afraid to say that there's racism in healthcare. Please don't get me started, but thank you.
If everybody speak directly to the microphone, because we have an audience online that we want to make sure they can hear. Again, thank you so much for allowing me to be a part of this powerful panel. It's amazing. So my journey actually started before I even knew it was a journey. My first pregnancy, I was 19 years old, very similar. In college, I had no idea what I was expecting and what I would expect from medical providers and from what the system that I was excited to be a part of as a nursing student. I was met with a lot of resistance when I had questions. I was given a lot of misinformation about what I had the ability to have access to. And I was talked into terminating a pregnancy just out of fear. Once I learned more about maternal health, I learned more about what my patients' rights were. It motivated me through my nursing career and to go into nursing and to make sure that I was the voice that other moms and other women saw, especially other women that look like me. So once I got into my second pregnancy, I was equipped, I was a nurse, I was a married woman, I went in for that preconception counseling, and I still met the same resistance. I had a lot of experiences where midwives would ask me questions as if they want to justify providing less adequate care. For example, I was asked to provide my marriage license during my prenatal visit, as if that had anything to do with my clinical care. Going through those experiences, I never realized that these were things that happened to just me until I started to open up and ask more women and build community. So going through those experiences, I started to look for what community looked like in other moms, other women who looked like me, and we started Melanated Moms 5 years ago. Once we started this, we started just as a small social group with 11 moms, having our kids in the same space, cultivating community with one another, and we started sharing these stories. And we realized that these things were not isolated instances. They're actually statistics that have been going on for many, many years. And one of the catalysts that actually moved this from just being a social group into being a movement is seeing these statistics. I asked myself and I asked my mom, how do we exist in real life but die, and we only live on these papers, right? We're only living as a statistic for data purposes, as opposed to living with purpose with our families. So we need to mobilize one another and motivate each other to be the change that we want and need to see. And that's what's really propelled us into being in this space and to continuing to hold space for other moms of and across the learning spectrum.
Thank you for sharing all of those very powerful stories. We're clapping right now, we're not just clapping for each of you, but for all the Black women and all the women who have experienced birth, and also all people, all birthing people who have to go through this healthcare system that's often biased against people of color, whether you're Black or brown. Somehow we don't seem to get the same level of care, and we have to advocate for ourselves. And as we were preparing for this panel, we were talking about messages and themes for today and what we wanted to leave with everyone. Before the next question, some of the things that had come up was that, advocacy doesn't require permission. And so I even invite the panelists now, if y'all can just chime in and talk a little bit about, I know you all talked about how you got started, it was through a personal experience, but even just to give a little nugget of encouragement to other women who may be in the room and other people who may be allies or bringing people who are in the room about what is it like, how do you actually get that done? It doesn't require permission. It comes out of a place in your heart and out of a place of injustice and wanting to see change. I don't know if anyone else wanted to chime in on that before we move on to the next question.
I think it really just starts with just asking questions. Advocacy is like pie in the sky kind of reality. I know that can also be hard too, right? Because we have been conditioned to believe that we don't have a voice. You don't question people with authority. You don't question police officers. You don't question teachers. You don't question adults, right? Oftentimes we've been raised to be seen and to not be heard. And so then you go to the adults who are seen and not heard, right? You go into spaces and then you feel like I don't have necessarily the voice to be able to speak or the agency to speak on a particular topic because maybe this person you may feel is highly educated or because they have some letters behind their name. And the reality is that they're no different from any one of us. One of the things that I'm really passionate about, and I thank my grandfather for, is he said, everybody puts their pants on one leg at a time, no matter what. I don't care who they are. And so in understanding that means that white, Black, yellow, doesn't matter who they are, at the end of the day, what is most important is respect. Respect. You don't have to like someone. You don't have to agree with their opinions. But what you do have to do is you have to respect their humanity and the fact that they are a living, breathing human being. And so as such, we have the right. If you woke up this morning, you have the right to ask questions. You are an expert within your body. Everything that has happened to you since you have come out of someone and you were birthed into this world gives you that authority, gives you agency over you, gives you the ability to say that I know what's going on with me. And if someone, says, well, no, that's not the case, realize that everybody's body is not the same, and how we show up in spaces and how we interact with one another is not necessarily the same either. And so if someone doesn't answer your questions to the fullest and capabilities that you feel like they should, then you go and you seek out someone else who can answer it and make you feel comfortable. And that's why I say that one instance with that midwife was so pivotal, because I had seen a Black OBGYN first, right? I thought that by seeing a Black woman That was all that I needed. And that's not the case. We also have to understand that we're indoctrinated into institutions that continue to perpetuate a framework that's not centered in uplifting Black bodies and Black people, then they too, we ourselves, our own people can still perpetuate that same level of harm. Right? And so we have to be conscious of that. We have to have a level of understanding of that. And so when I did find this Black wife, she did center my autonomy. She asked myself and my husband, what do we want? How do we see our pregnancy going? You know, what are the things what was important to me? You know, what are the things that came with me into my pregnancy that were concerns of mine, right? And so when you're thinking about that, in any of your, throughout the reproductive life course, whether you're having children, not having children, maybe you're raising children and you're talking to them about their reproductive health, it's important for them to know that they have their own bodily autonomy. They have their own agency over themselves. And that goes through all aspects of our lives. Not just going to seek out healthcare, but in education, you know what I mean? You know, Assemblywoman Zimmerman is working on, and we'll talk about more about policy, but working on, you know, educational reform and how we see ourselves within the educational system. And so it's important for us to ask questions. The worst they can say to you is no. Okay? And then you move on, you ask somebody else. Right? And we have to envelop that. And it can be scary and it can be uncomfortable at many different instances. But if the questions that don't get asked, don't get answered, and closed mouths don't get fed.
I just want to jump in and just make a comment as well with regards to advocacy. I think as we share our experiences, teaching our folks not to fear, don't be afraid to be called that angry Black woman. Speak up. You've been in a room, if you're in a room with your loved one who is there getting care, and that doctor or that provider comes in, and you know good and well you don't understand anything they said, and you have all these questions that just mentioned, you have a place too. For that doctor, when you stand by, you don't say, excuse me, I don't understand anything you said. Slow down, son. Slow down, man. Let's have this discussion. My wife doesn't understand, and neither do I. So don't be afraid to speak up. She just mentioned those questions, but even just questions, comments, you don't like how you've been treated, speak up. Not just those, speak up about those comments. Don't be afraid. If a person says, oh, well, I don't care for her, well, you know what? You gotta do your job. I'm gonna see that you do your job, and my life depends on it, and I'm gonna treat you as such. So we can't be afraid all the time to speak up. Oh, they might not like me, they might label me. They're already labeled you, they're already stereotyped, so what you gonna do, right? You have plenty to gain. Because you're already in a losing situations, you have plenty to gain. So don't be afraid to speak up and say, hey, I'm gonna advocate for myself. I don't care what you think. You're going to do your job, and you're going to do your job today.
And that's what I want to talk about. People generate energy. So if you're in a room folks, and that energy is not coinciding with the energy that you feel in your soul and your family has, you have the right at that moment to listen to your spirit and ask for them to leave the space. You have the right to look at them and say, I've got a set of questions. We have this philosophy about how this should proceed. And as such, we need to add somebody else to the team. You can't be on the team. This is my squad, this is my wellness squad, this is my squad, this is my home squad, whatever you want to call it. It's ours, we built this together. And we got a certain value system that we brought to this space. And we need for that. You can't be here, dear. So I want to say this one thing before I leave, because it's important, and as I think the legislature on this panel, like this because Black women stood up and said, we are tired of waiting for all that we deserve. And we need to represent ourselves and represent our communities. And so from federal legislation and the omnibus bill, um, Lauren Underwood gave it up to the nurse who decided to run for office and decided to make the changes, making the change. Support that legislation. Sign up. You may not live in Illinois, you may not understand federal policy, but sign up for those alerts. As simple as getting people to just text into certain senators and members of Congress is so important. They need to hear from us. We do a lot of talking in the beauty shops and the barber shops and after church and X, Y, and Z, but we need to talk to the people who are in decision-making seats because there's a very few people, and this is a people-powered democracy that we live in. Everybody in this audience has more power than just us. I tell people all the time, I represent 139,000 people, and it's little old me. So at any point that you all decide, they decide, right, that they want to move and the agenda is theirs, the light is theirs. And so I leave you with that. Understand that you have that power. And we are here to be in the world. All of us. Because even when we implement policies, when we pass bills, because then we get to the second stage of implementing policy. Pass legislation, it's only step one, right? Because now you gotta hear from you on how the implementation is going. Did they send you the check that they said that they were gonna send you to do this work? So it is a call and that's why we need in partnership with each other. And I would vote it doesn't stop. It doesn't stop with a piece of legislation being passed. It doesn't stop with the first check. It really is about us all working together in community and harmony to make sure that we advance this and the issues of Black maternal morbidity go away. So thank you all. Continue to enjoy this workshop. Thank you so much for moderating on my behalf. You know, ladies and gentlemen, family.
No idea what time it is. But yes, okay, so with that, that was a perfect segue. And Assemblywoman Zimmerman is really one of our champions, one of our better champions in Brooklyn, New York. We take our hat off to her every day, and we clap for her because she's really doing amazing work. So she has opened up conversation about legislation, policy, and we're going to kind of use that and kind of lead it a little bit right here. And we're going to talk a little bit about legislation. So on every level of government, but city, state, federal, as was mentioned, individual, the omnibus bill, and all sorts of things that are being sponsored from New York to California. To my panelists, and feel free to jump in wherever you fit in, what are the bills that you believe in the lives of moms and babies, and if specific bill that you can speak to, some change that you think needs to be done in order to impact the lives of moms and babies, and feel free to jump in whoever wants to start first.
Okay. So some of the bills I think I'll start from the is the omnibus assembly government, which is a cumulative of 12 bills that originally started out as 9. We're at 12 that really talk about the intersections of building parity in the workforce, putting funds towards the education of midwifery and the expansion of midwives. I think that during the pandemic we really saw the impact of how we need other access to other healthcare institutions and ways for us to be able to care for ourselves. And so building out the midwifery infrastructure throughout the United States will be pivotal, especially in communities of color and underserved communities. We don't have access to birthing centers or home birth midwives, right? And so building out that workforce, that would be wonderful. Access to veterans benefits for those who are veterans who have recently had children. There's the Kira Johnson Act, which really looks at how Kira Johnson had experienced a loss from not being listened to, and Charles Johnson, her husband, has been a supreme advocate for his wife. We have the Build Back Better Act, which has been passed in portions, but not in its entirety. On the state level, we want to look at informed consent bills and how it pertains to pregnancy and substance usage, and the legal drug testing of pregnant women at birth. Yesterday, I was in a wonderful bail reform hearing looking at family Miranda rights and how that intersects with individuals who are not being told their full rights in terms of when a family regulation system may come to their homes. The expansion of Medicaid postpartum for up to 1 year, I say it needs to go past that, and we really start to look at postpartum is forever. And when we look at postpartum mental health and the impact, especially within communities of color and the stressors that we have to face, and injustice, food security, just the nature of support services that are there or not there. Those being implemented, looking at a need for individuals who have experienced a miscarriage or a stillbirth. Oftentimes, an individual experiences a miscarriage or stillbirth and is still required to go to work the next day. But what would it mean for you to be able to have time off, to be able to center yourself, to heal, right, and then come back into the workspace and still be paid for that, right? Because that is a process that your body is going through. And then looking at, and again, the expansion of midwifery services, there's currently a CPM bill that is in New York State that would allow access to certified professional midwives, which is also really important. Recently in December, we had the birthing center bill that was passed, which would allow for the expansion of birthing centers, especially in underserved communities such as the Bronx, where there are none currently. With downstate New York, there's only one remaining birthing center, and I believe upstate here, there's only one, right, throughout the whole state. And so we really need to look at what does it mean to expand access to services outside of traditional hospital-based institutions. And so those are just some of the bills that I really want to lift up at this current moment. And of course, there's more, right? We also do work within Rikers Island, working with pregnant people that are there. And so what does it mean for someone's human rights to be centered while they're in the carceral system? Right, understanding that they're still a human being who's having a birthing experience, and that doesn't change because now they're in this center. And so the expansion and offering up of midwifery as well as dual services within the carceral system, but really truly they just need not to be there at all. And so looking at what is that.
Thank you for that, and I want to try something really quick. Can anybody in the audience name one piece of legislation that we should be advocating for? I know that was a mouthful.
New York has passed.
Karen Johnson Act.
Okay, the Karen Johnson Act. Did y'all, no, soak up anything else? That was a lot. Anything else? Midwifery, do those services?
I would really like to hear a little bit more about the package of bills again that Assemblywoman Zimmerman has in New York.
Okay.
I forgot the name of it.
Oh, so she was about the Mommy Bus Act?
Yeah.
Mommy Bus Act.
Thank
So that's federal legislation that was together by Congresswoman Lauren Underwood and Congresswoman Adams, and the Black Maternal Health Caucus, right? So that was developed, and you can Google Black Maternal Health Caucus, and you can learn more about the Mommy Bus Act and the ways in which to get involved. It's as simple as like sending an email or calling your state rep to really push for that election to happen. Oftentimes we think that, just in terms of advocacy, that understanding the legislative process can be hard. But I want to really lift up with Assemblywoman Zimmerman talking about, is like bills look really nice in the beginning, right? They look great on paper, we advocate, we put campaigns, but we really need to look at holding these institutions accountable once these bills pass. Right? And so we have to look at the implementation, and we have to look at accountability mechanisms that can really be put in place to lift that up, right? Because that's how good legislation goes out, right? That's how the people who really need them don't actually end up getting access to those things. Kimberly is a great example with the Earth Act of really being able to have an accountability mechanism that can really be driven into legislation to hold up, especially when we're talking about Black maternal health and we're talking about institutional reform and accountability, how systems can be accountable to their community, right? Because what's happening right now is that these institutions are within communities, but they're not extensions of the community, right? And so then you don't have community stakeholders who are actively pulling them for the harms that they are continuing to perpetuate within our system, within our communities on a daily basis. And so that really needs to change, and we have to really look at that.
Can I say to that as well?
omnibus that we're particularly interested in, which is also related to the data for Moms Act and the technology for Moms Act, right? And so we know that we have a data problem. Where all they want to do really is collect data around how many times we die or nearly die. And so what we do with the Earth Act, and it's like the word birth, but without the B, is that we actually collect experience of Black and brown working people and turn that into data. We don't have to die for them to and decide that they should analyze our care. That's a terrible, trigger or milestone for analysis. And so we say, learn from us while we're living. We have the first repository of Black and brown patient experiences of care in maternity and infant care. Use that to inform. Because what on the data is that they've been using this quote unquote evidence-based model, but it wasn't evidence-based on us, right? So I'm saying evidence-based on whom? And so we have to create new evidence-based that actually includes us and actually centers us and is rooted in us as the people who are being, most disproportionately harmed by this as the way forward. And so I'm really thinking through how we can use technology. We want to think about policy, but we also need to use technology. Everybody has access to their phone, and we really have to leverage all the tools, whether we're talking about policy, whether we're talking about midwives and doulas and their work actually helping birthing people, but also what is the role of technology to help advance our goals, to help advance the movement. And that's something that we're interested in, and that's policy that needs to happen. And then on the back end, as Chanel was saying, when these policies are implemented, how are they checking in with the community, right? So you may know that probably every place has been mandated to do an anti-bias training, anti-racist training, cultural competency training, whatever buzzword they're using right now. But they don't seem to check in to see that training literally includes the Black patients. So we users, and we're working with a number of organizations to say, hey, how about that training that you did wonderful? How about that new bill? How about that health equity initiative? Let's see what the Black and brown patients are actually saying about their experience, and we can use that to drive transparency by sharing our reviews publicly. We put that they cannot keep the information about our care in back offices and in hidden databases as they have been doing, but we are publicly sharing where we are getting good care, where we are not. We are putting our path as consumers, right? And saying, we are going to let folks know, as they say, put you on blast if necessary, that we are not receiving good care, or we are. And so that's our power as a community, and Assemblywoman Zimmer was really speaking to that. Like, we have power, and we have to lean into that as advocates, and that includes our consumer power, and being used to make sure these bills don't just become written things that don't actually improve all of the experience of care.
To add to that, just to add to that, data is incredibly important when it is disseminated by people who are also living these experiences and who also reflect the data. So to your point, having Earth and having that space where we are able to express what we've been through from our own words, using our own dialect, our own experiences and words, that creates way more visibility. It also creates quality data instead of just quantity, right? So they're looking at just numbers and seeing where we show up. This many people have died, this many people have had these issues. What is the quality experiences? What are the things that we can say has actually changed over time? How did it change over time? And how does that impact the way that the patient or the working person goes for other spaces for a better experience, right? Setting the saying what quality person experiences look like, it has to come from the people who have experienced it, right? It's very rare that I don't know of any person that will actually do that research of their neighborhood hospital to see what do they do for people that look like me? What kind of services are really reflective of my culture, my traditions, of the things that are important to my decision making and my healthcare, right? Those things are usually available, right? And if you have to look for it, you're usually met with a lot of resistance. So having these bills that are disseminated by us, that also not taken away from the pieces of data that will really show like the very apparent racism that appears in our care. Those things are really important. That is why it's protect, right, continuously using the people, don't want to include in the system. However, they want to take our money. However, they're being paid, whether it's privately, either from public insurance or not at all. They're always going to go home with a paycheck. So if I'm going to still be a part of your career as a medical provider, I need to also be included as a quality measure for how you're able to practice, right? So that's why these bills are important. We need to continue to push them on the state level as well as the federal level.
And I certainly agree with my colleagues and the comments that were made. We do have laws and guidance already on the books, such as patient bill of rights and informed consent. And then when you think about it, you got patient, when it's not being done, what can you do? Do you know what the patient advocate is in the hospital? Right. Do you know where to go if you're not treated right? Do you have something that you can call when you know that you're not being treated fairly? So I think too, it's good to have these bills, it's good to have legislation, but we certainly have to again hold people accountable and also teach our folks when things are not going right. When you see treatment, exactly what do you do? I mean, when you land in a hospital, there's good to hear all these wonderful things, but what exactly do you do? Are you informed enough to know what a patient advocate is or where you can actually complain? Another thing is, and I do agree with my colleague as well, Black Nurses Coalition, you know, her review and her review so that folks can communicate with us and let us know how their care was. Was it good? Was it bad? Sometimes we may have a particular hospital administration. For me, if I'm getting three of the same complaints in the same place, I got to knock on your door. I got to come. I got to make an appointment. I got to send you that email. I keep a list of contacts because I think it's so important to speak up for those who don't speak up for themselves. Right. So I think that is an area where we need a lot of help in also. And a big thing also that the Black Nurses Coalition does do is the mentoring piece. We need to diversify healthcare and healthcare providers. And I'm not just saying, people at the bedside, we need people in leadership positions. Okay? We need to diversify, not just saying, okay, well, housekeepers, African American, yeah, no. But we need people to look like their positions, make decisions about me, because evidently you don't know me.
All right, and thank you so much for that. Because we're getting into, well, we're running a little, we're going to take another 10 minutes, and we want to get to Q&A because I know that there's some really good questions out there. But we want to get a little bit into organizing right? And so we have these wonderful experts here with us, Kimberly representing New York City, but also in Chicago, and of course, the states that she's constantly in, depending on which day we can call her. We have Chanel, of course, who's also in Uganda and New York and Dr. Brenda Robinson up here in the Capital Region, and Jay, you are in New Jersey and also New York State as well, in Western New York. So, ladies, let us know as advocates, about support and people power for this movement, and let's try to make this quick. You can wrap it up in about minutes. If you tell us how can other social justice advocates be most helpful, and if you can talk about whatever grassroots work it is that we need to be engaging people in, and what that looks like in the areas where you're working, because each of you have a totally different lens.
Mm-hmm.
For us, we actually saw our biggest increase in community engagement throughout the pandemic when everything, right? So saw how impactful it was to organize our community members through those virtual channels, right? We also have our advocacy training called Find Your Roar, which has really catapulted us into a completely different space of what community building really looks like from within. We've been able to partner with so many new organizations, well-established organizations, Merchandise, Planned Parenthood, Advocates for Children of New York and New Jersey, and we've seen how much putting the parents, putting the working people, putting the families able to learn who they are as advocates, what the social impact really look like,
themselves, their children, their legacies, into what advocacy is. Together, across the state, across the country, a lot of really great people from UK as well as Australia to take our training and to also implement these same strategies within their communities. So we're learning more about how things that we see on the state level are not just in just this state or this county or this region. These things are happening nationally and internationally. So the Black mental health crisis is not just a regional issue. This is a global issue that is being impacted by so many other mountains and communities. So we want to continue to do this work together and continue to have partners like these wonderful ladies here. This is how we keep these things going, right? We work together collaboratively, not aside. And
for me, here in the capital region, just like the young lady said, partnership is so important. That community engagement is so important. Here in Albany, I'm born and raised right here in Albany, and we're not really unique because I don't know what every folks do, but we have a lot of access to our council member, especially when we have issues and we want to bring something to the table. Our county legislators are very available to us. So I think that is very important and a good way to go as well. But I do know in this community in the capital region, we have issues. We say this a lot: show up and show out.
Yeah.
Show up and show out. So if you want to get something done, not just sitting at home. Everyone has different talents and there's different organizations. But put those boots on the ground, join others, show up and show out.
thank you.
So one of the things that I would agree with, what I always agree with is one, any community work you're doing, going in, make sure that you're humble in your approach when you are going into this community, even within your own community. Oftentimes we think that because we're talking about Black maternal health is a universal issue, when it is not. The experiences of how we show up is very different depending on where you are regionally. So like, what I may be advocating for in New York City is not the same way I'm going to advocate here in Albany. Understanding how, if I'm advocating for a federal policy that is nationwide, then I have to take into account how legislation in a rural community is impacted, as well as a suburban and an urban community. I also have to take into the intersections of how we show up in our different identities, right? And so that's impactful, right? You don't want to go into teenagers like bills and they look. So this weekend, I'm a little bit old school as well, where I'm like, you have to go meet the people where they are, not where you expect them to be. And so show up in the spaces where they're showing up, right? Go to the hair salons, go to the places, you know, I have gone to Target and sat in the baby section and breastfeed right there on one of the stands and have answered questions from folks like, oh, you can do that? I didn't know you could breastfeed in public, or oh, you know, you can, you know, I can do this and I can. It is also right, because sometimes it's not always about what you say, but it's also about what you do. Right? And so like I try to throughout my work also bring my children with me to show as an example that we don't have to separate the things that we are passionate about and how we center community from our children. And make that something that is, you know, something that to them they're like, oh yeah, my mom like I'll come back, right? And I know that they take care of me. And so the legislators and other folks being able to see us and see how our children are impacted, see how future generations are impacted in this work is super important. And just, you know, it starts with, everything starts with an idea. Legislation, bills start with the idea. It comes from a place of asking a question, wanting to solve a problem, and having a conversation around it, and then building from there.
One of the things that we say, especially with using technology to organize, and I always let people know racism in New York City is not like racism in Mississippi. It works in both places, right? And so we can't even assume that the lived experience, as you know, saying it's not the same, right? It can be very, very different. And so one of the things we have to realize is that people are not the same. And Albany is not even New York City, even within our home state. And Rochester. Okay, we're up there working another whole different world, right? And so how do we understand that we don't want to fall into the trap the way society has acted as if we are all the same everywhere? And so even though we're leveraging technology, we are constantly on the ground. I'm heading to New Orleans in 48 hours, right? Because our community piece is always critical. We never make assumptions. We always ask permission to be in community with folks. But we have to understand that, you know, things look different. And that's what also we're excited about because we're providing hospitals, payers, and providers with hyper-local information, right? They should not be here in Albany trying to create policy based on terms in LA or, you know, Birmingham, right? Like we need the hyper-local experiences. And that's what we're trying to do with the Earth app to give those who are in policy or addressing policy. Local, hyper-local lived experience data, because that is the heart of community organizing. And I just want to end by seriously addressing what Dr. Robinson raised about advocacy. Right, it won't work if you don't have the tools, right? And I didn't know the question asked. I wanted to use a voice when I was being pressured, but I didn't know what to say. And I wish that I knew then what I know. I just wanted to share, like, we have a free ebook at earthapp.com that you can download. It will tell you about questions you should be asking from that very first appointment. What to say when they say this to you at the hospital. We do need the tools because it's education to advocate for ourselves. That's along that. I want to just because I feel like a lot of times we're talking but quite frankly, it's too late. And the real value, in my opinion, of what doulas do is the education they provide you, the way that they have retaught you what you were unlearned about your body, so that you have the education and the tools. And so, really want to lift up the doulas and the education work that they do in the community and individually as a big piece of how we can be better advocates in our birthing experiences.
Thank you so much for that. And because I know that there's another panel that's happening right after us at 10:45 with this person who's doing it. Sorry, it's still early. But I do want us to take 2 quick questions, and I will ask one panelist, we'll ask whichever, but one panelist can answer it, like in a rapid form, and then we'll give our call to action so we can hopefully exit the room in the next 5 minutes. So are there any burning questions in the room? I'll take 2. Any burnings? Any of our partners have questions?
Is everybody's contact information system located when we have access to
We have everyone's contact information. This program is actually streamed live on Public Advocates Facebook, LinkedIn, and YouTube. And we will provide, we can follow up to that and provide contact information. If not, feel free to reach out to the panelists after this and exchange information. Are there any other questions in the room? There's one question in the center.
Right. Sign up for Fighting Roar. Okay, you sign up for Fighting Roar. Go to Eventbrite, search Fighting Roar Validated Moms, and you will be able to find it.
Okay, and the last thing that we will do before we close out this panel, and thank you all so much for coming this morning. It's gloomy. This forum was at the crack of dawn, and it was a very busy night last night. So we're so thankful, we're grateful that you are in the seat. We are not talking to MTC today. So with our last left, can we do a quick call to action? Give your call to action and tell us where and when to join you in the fight for equity.
Nice.
All right, sure. So our call to action is sign up for Fighting Roar. We have in this training, we are on track to train 1,000 advocates. We are at 600 registered already in April. So we will definitely continue to have more parents, both males, females, however you identify at the table. Also join us on moms.com and you can see all the things we're doing, all the things with all the people we're just here. Thank you so much.
You were invested in New York.
We are blessed to have our newest location in Buffalo. We're going to be doing a community baby shower in June. More information to come on that as well. And also New Jersey. And yeah,
So that people know who to talk to maybe, because sometimes when we talk, we'll be talking to someone who's not in the region we are. Dr. Brenda Robinson.
Okay. Call us us, check out our website, blacknurses.coalition.org. We have several programs, engagements. We have a gala coming up, May 21st, Renaissance. Come check us out. We here for you and look forward to hearing from you.
So I have a couple, you can go to justfirstspace.org. That is a tech space that I'm co-creator of, and co-creator where you can take a learning with me and learn about things that you need to know prior to going into a high-paced institution. It's also a text line where you can text in and ask any kind of questions related to anything regarding reproductive health, institutional policies, things of the sort. You can also check out our website, ancientstrongservices.com, and you can get involved. We have a community baby shower happening on April 16th in Brooklyn, New York. We're also located in Brooklyn as well as everywhere. We serve all of New York City, the 5 boroughs, as well as, oh my goodness, Northern New Jersey, and I also teach folks how to become doulas. So if you're interested in becoming a full-spectrum doula,
And I hope actually just, first a reminder that our experiences have power, stories matter. Police acts, we were using those every day to identify hospitals that are doing well, to reach out to those who are not. That is the work that we and my team are committed to. So please, if you know anyone who's given birth recently, past 3 years, new parents, believe a prenatal review, a birthing review, a part of your appointment, as well as reviews for your baby up to baby's first year. And so please help us spread the word that clearly you can learn more about Earth at earthapp.com. That's IRTH. Follow us on social media at the Earth App on Instagram and Facebook. And then please feel free to learn more about me there as well. But mostly we really want our community to feel and to know that there's good, bad, and different, all of it matters. And we need to start sharing them publicly so we can inform and protect each other. And then on the back end, we can use that for data to go push the future.
With that, we just wanted to leave you all, have a wonderful and a blessed day. Question, we are over time. There is one question, before we get to that question, I want to thank our partners, and I do believe that one of our panelists, right, Dr. Brown, do you have to step up? Okay, we will excuse you. By tomorrow. Okay, I wanted to thank Ancient, the Brooklyn Perineal Network, the New York City Black Women's Political Club, Westchester Black Women's Political Caucus, of course, the Office of the New York City Public Advocate, Assembly Member Stephanie Zimmerman, Bronx Healthy Start Partnerships, and Einstein School of Medicine, New York Civil Liberties Union, Karen Jarrett is here, Association of Black Social Workers, New York City Chapter, Community Voices Heard, Executive Director, here, and also with her too.
Thank you.
New York State Nurses Association, Melanie Moms, of course, the coalition. And Shaniqua Charles, I know you wanted to ask one more question.
Just a really quick question. I'm located in the Bronx, New York, so I just wanted to know, are there any things specifically happening that are in the Bronx? We're very under, and just about everything. Yeah.
There's a great organization there, Rebirth. If you can find them on social media, and they're doing amazing work to really center the Bronx specifically. There's also the Birthing Place, which is also located in the Bronx, and they're working to build a birthing center in the Bronx. And so I would definitely check out those two organizations, the Birthing Place as DX Rebirth, and they're doing amazing work in the Bronx. And then the Bronx Centers, if you're looking for defense organization or anything of that sector, they also do community outreach.
Thank you so much. And with that, have a wonderful day, everyone.